In Chicago, we're seeing some trends that are a bit different than what's being reported on the national level. And so we are seeing a population that is primarily, so I will first just say that all communities in Chicago are being impacted. So across race and ethnicity, all age demographics, and really all community areas, we are seeing impact of the opioid crisis. In terms of overall numbers, we are seeing that individuals who are slightly older than what we're seeing at the national level, so primarily 45 to 64-year-old, adults, more men are being impacted in terms of the opioid crisis, and also individuals who are non-Hispanic African American have higher rates of overdose death than non-Hispanic whites or Hispanic individuals. Specifically, education for health providers has come in a few different flavors, and so we are providing many educational events focusing on safer opioid prescribing, but also very importantly, how to identify and diagnose opioid use disorder and then refer to treatment that's evidence-based. We are also working with treatment providers to make sure that they're aware of the evidence base of using medications for addiction treatment. And then we're working to expand treatment capacity through offering free trainings for providers, physicians, nurse practitioners, physician's assistants who are interested in being able to treat individuals with opioid use disorder with a medication called buprenorphine. And then we're providing training and technical assistance for agencies that are trying to expand access to those services. So not just how are you able to legally prescribe the medication, but then very importantly, once you get this waiver, how do you build services that provide evidence-based care and what systems need to be in place, and providing a lot of trainings around how to do that work. Recovery homes are places where individuals who are often early in recovery can go and have a stable living environment. They are not sort of formal treatment environments, but they are structured treatment environments where people can have some time really to get back on their feet. So they may be continuing to engage in formal treatment like outpatient or intensive outpatient, but really give them flexibility and time to be able to start looking for jobs, to start saving some money, to be able to identify safe housing opportunities moving forward, and can be really crucial, particularly in those early phases of recovery when people might not have a safe place to go or might not have access to housing through friends or family, and so can be a really critical piece of the overall recovery process. We as a city health department don't run a naloxone program directly, but we fund community agencies who are doing this really important work. And so we have two sort of funding streams right now that are going into the community. The first is one that funds an agency called the Chicago Recovery Alliance, and they provide services, primarily mobile services on a van, that go out and provide education to community members, to other agencies on how to identify an overdose and how to administer naloxone. They also give out the naloxone kits for free. We have a second and newer project that just started this year in 2018, where again it went through competitive bid, and so 3 agencies actually came forward to do this work, where they are going to be hiring and training community health workers who are primarily peers, so individuals with lived experience, to take the same type of information. How do you identify someone who's overdosing, and then how do you administer naloxone? Train community members on that, and then give people naloxone kits. And so this work has been really specifically focusing on the communities that have the highest rates of overdose and death. And so the 3 agencies that are doing that work now are the Chicago Recovery Alliance, Men and Women in Prison Ministries, and Heartland Human Care Services, which offers supportive housing for individuals. And so we're really excited about this pilot, particularly with the linkage to Men and Women in Prison Ministries, because we recognize many people leaving incarceration are at high risk for overdose. And so we really want to make sure that we're getting these resources to the people at highest risk.